Hello, my name is Kara Jones, and these are my classmates, and we're a part of the Atlanta Technical College Physical Therapy Assistance Program, and today we're going to be discussing blood pressure.
The blood pressure is the pressure of the blood within the arteries. It is produced primarily by the contraction of the heart muscle. Its measurement is recorded by two numbers. The first is measured after the heart contracts and is the highest. The second is measured before the heart contracts and is the lowest. A blood pressure cuff is used to measure the pressure.
120/80, that's the range between normal blood pressure. High blood pressure, also called hypertension, is considered when blood pressure is constantly measured with 139/90. That is considered high blood pressure or hypertension.
Factors that affect blood pressure is exercising, anxiety, food consumption, and alcohol.
Hello, my name is Alex Pickens, and I'm a student at Atlanta Technical College Physical Therapy Program. And I'm here to talk to you about some factors that affect blood pressure. There are three factors that affect blood pressure, and they are cardiac output, blood volume, and resistance to blood flow. Cardiac output is the amount of blood that your heart can pump. And an increase in cardiac output can increase blood pressure. Blood volume is the total amount of blood within your body. And an increase in blood volume can increase blood pressure. And resistance, there are three factors that affect resistance to blood flow within your body. The flexibility of the artery wall, a decrease in the flexibility can increase blood pressure. And the diameter of the artery wall, a decrease in the diameter increases blood pressure. And the viscosity of the blood flowing through the arteries, thicker the blood, the higher the blood pressure. Over time, prolonged high blood pressure can cause heart attack, kidney disease, and stroke. So medications used to treat hypertension or high blood pressure are beta blockers. They're used to decrease cardiac output and the overall work of the heart, and that decreases blood pressure. Diuretics, also known as water pills, are used to decrease blood volume by increasing activity in the kidneys. And there's a group of medications that act in different ways to increase the diameter of the artery wall. And they are ACE inhibitors, angiotensin II receptor blockers, calcium channel blockers, and direct-acting vasodilators.
Now we will demonstrate how to take the blood pressure. First, you secure a proper size blood pressure cuff onto the upper extremity. You want to make sure that the artery line lines up with the artery of the arm. You then put your stethoscopes in, and you want to have it right on the artery where you're going to be taking the blood pressure from. You have a ball that's going to fill the blood pressure or squeeze out the air, and then you have a gauge. Like Amaya stated before, the high number, which would be the first heartbeat you hear, would be your systole, and then the last heartbeat that you hear would be your diastole. So you want to make sure the valve is closed, meaning you don't hear any air coming out as you pump. You want to pump until you get to 220 millimeters of mercury. Once you get there, you want to slowly release the valve to let out the pressure of the blood pressure cuff, and you listen for the first beat. And then listen for the last beat, and then you release the valve.